Hi, Ashley. I've been working with my patient Johnny. He's a 10-year-old boy in the fifth grade, and I've been seeing him for about a month after his accident. I've just been working with him on his tripod grasp. I've just been noticing some unusual comments about what he's saying about his family and his home situation. I know his father recently left, so I'm just a little concerned that there may be some other issues going on inside of his home that I'm not too sure about. I was also informed from in school that he's been acting up in class and not able to concentrate, and I wanted to see if I could refer Johnny to you.
Hi, Rebecca. Yeah, I can definitely look into that. How about we schedule an appointment? Are you available to meet sometime this week?
How about this Friday at noon? Does that sound good?
Perfect. I'll see you then. Hi, this is Gloria. Can you tell me a little bit about what you do?
I'm a clinical social worker at a nonprofit hospital.
Which nonprofit hospital?
I work at Kennedy Krieger Institute
Okay, and where is that located?
in Baltimore, Maryland.
What were the educational requirements to become a social worker?
To be a social worker, I don't think the bachelor degree really matters that much, but I had to go to school for social work to get my master's for 2 years, and that's the educational requirement.
Okay.
Yeah.
What was the process for you to become a social worker before you started working? So, like, any exams, observation hours?
So during the 2 years in grad school, the first year you have a 2-day-a-week internship. It's not as intensive, but I got some clinical hours through that. And then the second year is a little bit more intensive. It's 3 days a week. And then you get experience that way. My track was clinical, but you could do clinical or macro, which is community based. So for me, I did clinical, so I did therapy work my second year. And it's under the supervision of a licensed clinical social worker. So I actually interned at Kennedy Krieger for my second year, and I liked it so much, so I applied for a job there. So that's kind of what I have to do during school. There's like certain requirements for each state. So for Maryland, I think it's like 3,000 hours of clinical work after. It's equivalent to about 2 years after you graduate.
Before you actually start work.
So so you get your graduate clinical license, right? And then afterwards you have to get a job, and you have to like track all your supervision hours, your clinical hours, and things like that. And then you also have to get continuing education units as well. As you're doing that, then there's a certain amount of client hours. I don't even remember the exact number, but certain number of client hours, supervision hours, group supervision hours, and CEUs, which is the continuing education units. And then you have to apply to take the official like clinical exam. That's like the nationwide exam. So then you do that. So it took me 2 years because Kennedy Krieger has a lot of clients, so I got a lot of client hours, so I was able to do it. But it's a minimum of 2 years of work you have to do, but most people take longer.
What are the different settings where a social worker can work?
You can work anywhere.
Oh, really?
So like even within the hospital, there's like the case management side or the clinical side. You can work in the emergency room to basically assess safety for people that came in for like if they're having a psychotic break or whatever. You can work in outpatient mental health setting. You can work in like a dialysis center and like do case management and set them up with services there. You can do community work and work for nonprofits or like different organizations that you might be interested in. There's a lot of stuff you can do.
Have you ever worked with an occupational therapy before? Therapist?
I haven't worked with an occupational therapist directly. I've worked with them like via email and phone calls. We do have lots of OTs at Kennedy because we have like specialties so we have the autism clinic, we have cerebral palsy clinic, we have like neurological stuff like brain clinics. So all of those clinics have OTs on staff that work with some of the kids that come in. So sometimes like if I see developmental concerns that would require an OT, I might refer them to our outpatient occupational therapists, or there's other departments that work with, depending on like if they have autism, then they would specifically go to the autism clinic, things like that. So we collaborate a lot with them. I have a kid right now that is like possibly on the spectrum. We're getting him tested, but there's definitely some gross motor skills that he's just not developmentally on track. Like it's blatantly obvious when I'm working with him. And so we referred him to OT, and he's getting services there. So like if something comes up during his OT appointments, and she'll email me or call me like, hey, this came up, like, you know, is there a way you can handle it? Since I'm doing trauma work with him and helping him with anxiety and like talking about feelings and things like that, if that piece comes up with them, they're like, this kid's super anxious, is there something that works with you in therapy? Then I can share with them like, these are the coping skills we're like working on and learning about. So then they can use it in session with him, so that it's not like reinventing the wheel, like they don't need to come up with their own. So we collaborate in that capacity.
Like if you have the same client that you're saying, and then you like talk to each other about that client.
So that's needed,
And under what circumstance would an OT refer a client to you?
So like what I do, sometimes they're referred for physical stuff, right? Like whether it's speech person or like OT, they will notice or something will come up in session where they might see bruises or the kid discloses some kind of trauma, whether it's some kind of abuse or like witnessing domestic violence or whatever it may be. So then because we're a specific trauma center, Kennedy is like really good about internal referrals, so they can just refer them to us pretty quickly. We have a pretty long wait list most of the time, so it's hard, like, they come in for the diagnostic interview, and sometimes they have to wait a little while to get assigned a therapist because we have so many kids waiting. But yeah, the referral process is pretty easy, and so if things come up in their OT sessions where they're not, you know, trained to do the trauma work or do therapy, then they'll refer them to us.
Okay.
Yeah.
Do you love what you do?
Yes, I love what I do. I don't think I would do anything else. People ask me that all the time. They ask me how I do my job, especially because, like, with Kennedy, like, I mean, even our name is Center for Child and Family Traumatic Stress at Kennedy Krieger Institute. It's a really long name, but we deal with trauma all the time. So, like, but I love it. I don't know what else I would do. I think I'm gonna do it forever. So, yeah.
Was it hard, like, your first year?
I was trained there, so I kind of knew what to expect. I also, like, my first year internship where it was twice a week, I worked at a residential treatment center that was a level 5. So, like, I was constantly hyper vigilant about, like, if I'm going to get attacked or, like, if this kid is going to do something. Like, it was really bad. So, like, I think because I started off with something that was so intense and then I went to an outpatient setting instead of kids that are living there, for me, that switch was a little bit less stressful. And then because I was trained at Kennedy, it's like, you know what to expect. So I actually think it was stressful to get like a full caseload, because as an intern you only have 5 to 6 cases, and then you help out with group therapy. But then all of a sudden, like, having like 20 plus clients, that was a little like hard to get used to. But I mean, yeah, overall it wasn't too bad.
Hey Ashley, I just wanted to get an update with you just to see how Johnny was doing with you. He's actually been improving a lot in our therapy sessions.
Yeah, Johnny's improved a lot with his social participation skills, and he's actively communicating and expressing how he feels to me.
Well, awesome. I'm super glad to hear that. Thank you so much for your help, and let me know if there's anything that I need to know or do in the future.